Madam. Continuing the lectures on CBME, uh, basic understanding of microbiology is very essential to learn the microbiology as a subject. What I am going to teach you is the alphabets which you are going to learn to understand. To learn any language, you have to learn alphabets like ABCD to English, IE to Kannada. Like that, you have to understand what are the organisms uh, that are you need to study during next 1 year of your course, and it's very important. Unless you learn these alphabets, you will not understand the subject. Now, basically organisms are classified into three types: saprophytes that thrive on dead and decaying matters; pathogens which cause infections in man; opportunistic pathogens which are normally present, but when they get an opportunity, they cause infections. Now, now, depending on the temperature requirement, they can be classified into psychrophils, mesophils, thermophils. Psychrophils are saprophytes, mesophils are pathogens which cause infection, thermophils which are used as an indicator for sterilization technique, Bacillus thermophilus. Now, moving on to the pathogens, they are blackly classified. Now, coming to the spherical shape bacteriology, classification of bacteria, they are classified into cocci, bacilli, vibrio, phylum, spirochetes, actinomycetes. There are 5 cocci which are pathogenic importance. The important first one is staphylococci. It's a gram-positive cocci arranged in clusters. They are arranged in clusters because they divide in all the planes. Daughter cells fail to separate out mother cell. It's a pyogenic cocci. So all the infections which gives rise to pus are produced by Staphylo. Staphylo means bunch of grapes in Greek. It was discovered by Augustine. Uh, it also produces non-pyogenic infections due to enterotoxins. They are enterotoxins and exfoliative toxins. There are 3: food poisoning, toxic shock syndrome, and superficial skin scalding syndrome. The next cocci is streptococci. It's a gram-positive cocci arranged in chains. It is arranged in chains because it divides in single plane and daughter cells fail to separate out from other cells. And it is also a pyogenic cocci, but very important, it is highly sensitive to penicillin. But what we are worried is the post-streptococcal sequelae. There are 2 important sequelae. You have to remember ARF and AGN, acute rheumatic fever, pancreatitis, and acute glomerulonephritis. These occurs in 3 weeks, 3% of cases, 3 weeks after the acute infection. They are very, very important because especially rheumatic fever, the prevention is the patient has to take penicillin for up to 17 or 18 years. Now, sore throat is followed by acute rheumatic fever, and skin infection, especially scabies, is followed by the glomerulonephritis. The pneumococci, it's called pneumococci. It is causes pneumonia, pneumonitis, and it's a lanceolate, flame-shaped porcocci including single capsule. It's a gram-positive and causes pneumonia. Next one is meningococci. It's a half moon, plano-convex, plane surface facing each other, and it's also, some strains are capsulated, and it gives rise to meninges covering up the meninges. Meningococcemia is called as Waterhouse-Friderichsen syndrome. Moving on to the gonococci, it causes females are the reservoir, males are the spreader. It gives rise to gonococcal arthritis, gonococcal urethritis, followed by, in chronic cases, it can also cause urethritis. And it is one of the important causes for the blocked tube, and one of the important causes for blocked tubes. And fertility, before treating fertility, they should undergo screening for gonococcal infection. So please remember, there are 5 cocci. Staphylococci, gram-positive cocci cluster, Streptococci, gram-positive cocci chain, Pneumococci, lanceolate shape, flame shape, two cocci influencing capsule, Meningococci half moon shaped, plain surface facing each other, and Gonococci kidney shaped, concave end facing each other, and it's a gram-negative intracellular organism causes gonococcal arthritis. Moving on to bacilli, bacilli are classified into three criteria. One is gram staining, second one is spore forming capacity, third one is the acid fasting. The acid fast organisms are Mycobacterium tuberculosis and Mycobacterium leprae. They are not stained with gram stain because of thick mycolic acid in their cell wall. Now, spore bearing organism, the organism which forms spores in the presence of oxygen is anthrax. It's called aerobic spore bearers. The organism which forms spore in absence of oxygen is called anaerobic spore bearer. Now, the Clostridium, anaerobic spore bearer, anthrax, aerobic spore bearers. Now, gram-positive bacilli, mainly the Corynebacterium diphtheriae. It divides like a stem or shoot of the tree and gives rise to LRV shaped, and polar granules are there. They are metachromatic granules. And Listeria monocytogen, it gives rise to meningitis. It shows tumbling motility, dual motility. And lactobacilli present in the milk. Erysipelathic rhizopathy gives rise to thinner milk. Other gram-positive organisms are Actinomycetes and Nocardia, although we stain with special modified Zealand staining. So, gram-positive, gram-negative bacilli are all Enterobacteria, Salmonella, Shigella, Proteus, E. coli, Klebsiella, Vibrio cholerae. These are all and spirochetes and Spirilla minus. There are a group of organisms with you should remember with mnemonic BBHY, Bordetella, Brucella, Haemophilus influenzae, and Yersinia pestis. And there are a lot of other organisms you have to study. Like these are comes under miscellaneous organisms. Legionella, Pneumophilia. It gives rise to pneumonia. Gardnerella vaginalis, Helicobacter pylori. These are all these are organisms. There is a group of organisms which neither belong to bacteria nor belong to viruses. They are classified under Rickettsia and Chlamydia. Some of the properties are like viruses. Some of the properties are like bacteria. Rickettsia, flea, fly, are tick-borne, and chlamydia, cytocosis, trick agent, trachoma including chlamydia, including conjunctivitis. Chlamydia trachomatis is one of the sexually transmitted disease. So there are so many bacteria you have to study, like pathogenicity, how they cause infection in man, how they enter the human body, breach the immune defense mechanism, and what they give rise to, and you have to write the laboratory diagnosis and treatment part of this, and you should be thorough in the treatment of infectious diseases. Although India is a developing country, we still 70% of cases which come to the OPD still are infectious diseases. So please remember all these basics of microbiology to go on to study the microbiology as a subject. So bacteria are classified depending on the shape, and you should know all the bacteria, and you should not forget, and whole disease process you should memorize and write it in the examination.